Thanks, Anton. Again, write your questions down. Our next speaker, we're going to switch the order a little bit. Megan's going to go before myself. Megan Warko is our next speaker. Megan is a physical therapist. And as you probably know by now, how important exercise is, whether you have arthritis or not, whether you have osteoporosis or not, whether you're going to have surgery or not, exercise plays a role in every person's ability to obtain healthy bone and joints. Megan, we're fortunate, runs our gym, our upstairs in our program, and she has created a tremendous team of people to help take care and get people up and moving, like we said, the night of surgery, which is a challenge unto itself at times. So Megan's going to talk about how to maintain healthy bones and joints through exercise.
Good morning, everyone. I'm really excited to get to talk to you today. I'm not going to talk specifically about the rehab protocol after surgery, so if you have specific questions, we can talk after, or you can write them down. I'm just going to talk more in general about exercise. So I wanted to start off here. I took this picture last night. It was my grandparents' 60th wedding anniversary, and I thought it appropriate because both of them have had both their knees replaced, and they still love to dance. And they exercise a lot, so that's really important. My grandfather loves to dance, do yard work, and my grandmother walks a lot, so congratulations to them. Too bad they're not here. They're probably still sleeping. All right, so today I'm going to talk to you about why exercise is so important, what types of exercise you should be doing when you're completing an exercise program, what to do if you want to begin an exercise program if it's been years since you've exercised, or if you just want to get something a little more routine going. And what does the research say about exercise and arthritis? Additionally, if you have osteoporosis, what you should take into consideration with exercise. And then we'll get up a little bit and we'll do some of the exercises. Why is exercise important? Well, it aids in weight loss and it can help you to maintain a healthy weight. If you're someone that is overweight at this point and you have arthritis, it's really important to try to get to that healthy weight. LaDonna spoke to that about her friend who was able to lose some of the weight through Dr. DeJoya's recommendation, and this helped her to reduce some of her symptoms. So that could be something that would be beneficial to anyone here. Exercise will help you to improve your function. So if you're unable to walk through the grocery store or at the mall, and that's something you want to work on, exercise can help you with that. Decreases stiffness. Lots of times people who suffer from arthritis get up in the morning and they say, oh, I'm really stiff. Or my patients get out of bed and I say, how was your night? And they tell me, oh, I'm just so stiff. Exercise can help you to feel better and to get your joints moving again. Obviously, exercise is going to increase your strength. That's important if you suffer from osteoporosis, because if you are able to strengthen your muscles and keep yourself from falling, that can help reduce the risk of fractures. Not only is exercise good for your joints and your bones, but it has full body benefits as well. It's beneficial for your heart, your mind, your lungs. So everyone in this room can benefit from arthritis. If you're sitting there thinking to yourself, I'm in too much pain to exercise, there are ways around that, and there are things you can do, and it will help with your overall health, not just for your joints and your bones. Okay, how many of you already have an exercise program? Wonderful. If you do or don't, these are the three components that I hope you have as part of your program. They're aerobic training, resistance training, and stretching. Aerobic training. What is aerobic training? It's repetitive use of your large muscle groups. So walking, running, cycling, swimming. Obviously, you don't need to be like these gentlemen in the picture here and be running Olympic times, but anything that you can do to get yourself up and moving for a length of time. When we talk about even the walking programs, that can be done in a pool. So if you don't want to be outside, you can be inside their indoor tracks, pools. And aerobic training is beneficial for people with arthritis. When I was looking through some of the studies, two of the main things I saw were walking programs and cycling programs. Walking programs, patients who were diagnosed with arthritis and went through these programs reported less pain and improved function after participating in these, more so than someone who has arthritis and is just sitting all the time and not trying to exercise. Same thing happened with a cycling program. These people who had arthritis and they went through this program reported decreased pain. One important thing to note here with that is when I talked about exercise and it's important to improve your function, you kind of want to practice what you want to get better at. So the walking program here I think is really important if that's something you want to be able to do more easily. Working on the cycling will help, and it will give you the benefits of exercise, but it's not going to specifically target walking. So that's why a walking program is so good. It's something you do every day and can help you to improve that. Resistance training is the second component of a good exercise program. Another term for this would be strengthening. And this is active muscle contraction resisted by an outside force. So that could be using weights at the gym, or it could just be moving your joints against gravity, and the weight of your limbs cause the resistance there and can help you get stronger. Resistance training is important for joint protection. And a couple areas where this is very important is in the knee. If you have arthritis in your knee and you can strengthen the musculature around your knee, then that can take some of the pressure off the joint, and that's a lot of times where people can have some pain relief. Additionally, if you have arthritis in your back, I know that's not quite as common or you don't hear that as much, but if you strengthen the muscles that help to hold your body up against gravity, then you can improve your posture and take some of the pressure off of your joints in your back. So those muscles would be your core muscles in your abdomen and your low back, even your leg muscles to just help hold you up against gravity. Resistance training also aids in weight loss, so it's kind of part of the whole package along with the aerobic activity. Just burning the calories will help you to get to a healthy weight. Obviously, it's going to build muscle strength because you're targeting those specific muscles, but then it'll also help with your bone strength as well, and we'll talk a little more about that when I talk about osteoporosis. And the research seems to show that resistance training and aerobic activity both will help to reduce your symptoms of arthritis. Stretching, key component here to any exercise regimen. This is motion to lengthen the soft tissues and increase your range of motion. Definitely key when you talk about being stiff. And stretching is something that I recommend doing during warm-up and cool-down of the aerobic activity and the resistance training. This is something that can be done daily and should be. You can do it in the morning when you wake up to help kind of get your body moving before you get out of bed, kind of do it as you're getting out of bed. Just helps to improve your joint flexibility and see how flexible you could be, just like this woman. I don't know that I could do that, so. And hold my balance. All right. So exercise and osteoporosis. There's not really a set of exercises that I would recommend. You must do this, this, and this if you have osteoporosis. The literature seems to be showing me that the exercise program that I kind of just went through, having those components, are definitely beneficial. As we start our lifespan and we're younger, we are building the bone as we do very high impact activities such as running, jumping. As your body ages, hasn't really been a consensus as to if that high impact activity will just help you to maintain the bone density that you have from being younger, or if it will continue to increase that bone density. So I just recommend continuing to do activity because at least you're trying to maintain what you already have.